welcome to Rajya TV. My name is Aditi Nagpal Girotra and you're watching News Tonight, where we bring you news updates from India and around the world. India-China commanders of the Indian and Chinese armies started a crucial round of negotiations on Tuesday to finalize a framework for a time-bound disengagement process from friction points in eastern Ladakh.
The fourth round of Lieutenant General level talks began around 11:30 a.m. in Chushul on the Indian side of the line of actual control. According to reports, the key focus of the high-level meeting was on the rollout of Phase 2 of the disengagement process, including in Pangong Tso and Depsang, besides withdrawal of forces and weapons from the rare bases in a time-bound manner. The Indian side once again demanded the total restoration of status quo ante in all areas of eastern Ladakh prior to the 5th of May, when the standoff began. The two sides also discussed a roadmap for overall restoration of peace in the high-altitude region that witnessed an 8-week bitter standoff between their troops. Commander-level talks between India and China are taking place days after the implementation of the first phase of the disengagement process from the friction points.
Novel coronavirus cases crossed 9 lakh in India on Tuesday. However, the Health Ministry assured there has been a progressive decline in daily growth rate of new COVID-19 cases, with total recovered cases of COVID-19 about 1.8 times the number of active cases.
28,498 coronavirus cases were reported on Tuesday, taking the total number of cases past 9 lakh. In the past 24 hours, total deaths reached 23,727, with 553 fatalities being reported. India has over 3 lakh active cases, while recoveries exceeded active cases by 2.59 lakh. Recovery rate improved to 63.02%, while the mortality rate dropped to 2.6%. Over 1.2 crore samples were tested for COVID-19. Of them, 2.86 lakh were tested on Sunday. 22 states are currently performing 140 tests per million people per day. According to the Health Ministry, COVID-19 cases per million in India are amongst the lowest in the world. Deaths per million is also among the lowest in the world.
अगर आप मृत्यु देखें, डेथ पर मिलियन पॉपुलेशन देखें, तो वहाँ भी भारत में डेथ पर मिलियन पॉपुलेशन कोरोना से होने वाली मृत्यु बहुत कम है, 17.2 प्रति मिलियन है, और अन्य देश ऐसे हैं जहाँ ये 35 गुना भारत की संख्या से है.
86% of total active cases are in 10 states. 50% are from Maharashtra and Tamil Nadu. Maharashtra on Monday registered 6,497 new COVID-19 cases, taking its total patient count to over 2.6 lakh. With 193 deaths, total number of COVID-19 facilities in the state were 10,482. Mumbai had 1,158 fresh cases to take its patient count to 94,146. With 47 deaths, the death count in Mumbai so far is 5,335. Tamil Nadu recorded 4,328 fresh COVID-19 cases on Monday, taking the state's tally to 1,42,798. Chennai alone reported 1,140 positive cases to take its total to 78,573. Tamil Nadu had 66 deaths on Monday. The death toll stands at 2,032. In view of the rise in cases, Tamil Nadu had extended the suspension of bus services till 31st of July. In Bihar, total lockdown will be imposed from 16th to 31st of July. Infections in the state rose to 18,853 with a record 1,432 new cases in the last 24 hours. The state reported 9 COVID-19 deaths on Monday. The state has lost 134 lives so far. Meanwhile, with fast-spreading virus infections, Karnataka has gone past Delhi to have the third highest number of active cases. In Assam, 4 more COVID-19 patients, including a senior doctor of the Guwahati Medical College, died, while 1,001 new cases were reported on Monday, taking the case tally to 17,807. Pune district reported 1,333 new coronavirus cases, the highest single-day spike taking its tally close to 40,000 on Monday. 23 more patients succumbed to the infection. Meanwhile, ICMR Director General Dr. Balram Bhargav said 2 indigenous Indian candidate vaccines have been cleared to start early phase human trials this month. 1,000 volunteers are taking part in the clinical trials for each of the 2 indigenous vaccines.
There are 2 indigenous candidate vaccines, and they have undergone successful toxicity studies in rats, in mice and in rabbits, and these data were submitted to the Drug Controller General of India, following which both these candidate vaccines got clearance to start the early phase human trials early this month.
Bhargav acknowledged the possibility of some airborne transmission with micro droplets, adding that physical distancing and use of masks remains important. Bureau Report, Rajya Sabha TV.
Vice President M. Venkaiah Naidu praised the actions of a doctor in Telangana who shunned prejudice and stigma against COVID-19 to help transport a coronavirus victim's body to a crematorium for his last rites.
Dr. Pendaila Sriram, District Nodal Officer of Pedapalli District in Telangana, drove a tractor carrying the victim's body to the crematorium after the municipality driver refused to do so for fear of contracting the virus. The patient had passed away on Monday. Vice President Naidu said the noble act of Dr. Pendaila Sriram will inspire others. He added that his selfless service is an outstanding example of India's age-old philosophy of sharing and caring.
The HRD Ministry on Tuesday issued guidelines to states and union territories on the education of migrant workers' children who returned home during the COVID-19 pandemic.
The ministry has asked states to ensure that names of migrant children are not struck off the school rolls. They were also asked to prepare a database of children who have left the local area for their homes in other states. The government said such children should be noted in the database as migrated or temporarily unavailable. The ministry suggested that states may direct all schools admit any child who has recently returned to village without asking for any other documents except for some identity proof. The lockdown on 24th of March to contain the spread of coronavirus had led to an exodus of migrants to their home states, disrupting their children's education.
On Monday, media reports said that Russia claimed to have successfully completed the world's first clinical trials of the coronavirus vaccine on humans. Some Russian scientists were even quoted as stating that the world's first coronavirus vaccine will be launched in August. Given that many experts across the world have stated that a vaccine could take as long as 12 to 18 months to be developed, let us examine how true is the Russian claim.
Till date, the World Health Organization has listed 21 vaccine candidates globally that are in the clinical evaluation stage. China has 4 potential coronavirus vaccine candidates. They include Wuhan Institute and Sinopharm's candidate at the phase 2 stage, Sinovac and Instituto Butantan at phase 3 stage. CanSino Biological Inc. and Beijing Institute of Biotech's potential coronavirus candidate is approved for military use. Beijing Institute of Biological Products and Sinopharm's vaccine candidate is at phase 2 stage. UK's University of Oxford coronavirus vaccine candidate is at phase 3, while the one being developed by Imperial College London is in phase 2 stage. In the United States, potential COVID-19 vaccines developed by Moderna and Novavax are both at phase 2 stage. In Germany, BioNTech, Pfizer and Fosun Pharma's potential vaccine candidate has reached phase 2 stage of development. In Australia, Vaccine Pty Limited and Meditalk's potential vaccine candidate is at phase 1 stage. In general, a vaccine candidate goes through development stages that include exploratory stage, preclinical stage, clinical development, regulatory review and approval, manufacturing and quality control. Clinical development is the third stage. It is made up of a 3-phase process. In phase 1, small groups of people receive the trial vaccine. In phase 2, the study is expanded and the vaccine is given to people who have characteristics like age and physical health similar to those for whom the new vaccine is intended. In phase 3, the vaccine is given to thousands of people and tested for efficacy and safety. This rigorous phase of testing alone could take 6 to 8 months. The claims over the Russian vaccine candidate needs to be seen in the light of these facts. Coming to India, the first indigenous COVID-19 vaccine, Covaxin, jointly developed by Bharat Biotech, Indian Council of Medical Research and National Institute of Virology, Pune, has entered the human trials phase. Also, Zydus Cadila has been approved for human trials of the coronavirus vaccine this month. Gurugram-based biotech company Premas Biotech has developed a triple antigen virus-like particle and has moved to the animal trial phase. Bureau Report, Rajya Sabha TV.
The World Health Organization has warned that the coronavirus pandemic is worsening globally and that there will be no return to the old normal for the foreseeable future.
On Monday, global infections surpassed 13.2 million with more than 500,000 people dead. The agency has called upon countries to make comprehensive strategies to deal with the pandemic.
If populations do not follow the basic public health principles of physical distancing, hand washing, wearing masks, coughing etiquette, and staying at home when sick, if the basics aren't followed, there is only one way this pandemic is going to go. It's going to get worse and worse and worse.
The Americas account for more than half of the total global cases, with over 6.6 million infections. Europe has over 2.92 million cases, while Eastern Mediterranean region and Southeast Asia reported over 1.28 and 1.16 million cases respectively. The number of COVID-19 cases in the United States surpassed 3.35 million, including over 135,500 fatalities on Tuesday. Infections have risen rapidly in about 40 U.S. states over the last 2 weeks, including in Florida, California, Arizona, and Texas. On Monday, California reimposed restrictions, shutting bars and banning indoor restaurant dining, closing churches, gyms, and hair salons. Brazil on Monday reported over 1.8 million cases in total, while nearly 73,000 people have died from the disease. Peru has recorded over 330,000 cases so far. Economic activity has resumed in most of the country despite the rising number of cases. However, restaurants and similar establishments have been asked to operate at 40% capacity from July 20th. On Tuesday, Moscow further eased COVID-19 restrictions and people are no longer required to wear masks outdoors. However, masks are still required in public transport, stores and other public indoor places. Russia has registered over 739,900 coronavirus cases. On Monday, French Prime Minister Jean Castex signed a budget deal of more than 8 billion euros for the country's health system. The money will be used to increase the pay of healthcare workers. Hong Kong is temporarily closing the Disneyland theme park from July 15th amid rising coronavirus cases. 52 new cases were reported in Hong Kong on Monday, forcing authorities to tighten social distancing measures. Australia on Tuesday tightened restrictions in several states after a fresh outbreak of COVID-19 cases. Queensland introduced mandatory quarantine for people coming in from New South Wales. Victoria recorded 270 new coronavirus infections, taking the state's number of active COVID-19 cases to over 1,800. On Tuesday, the national tally of cases surpassed 10,000. Meanwhile, South Korea has outlined a plan to spend $95 billion in creating jobs and help the economic recovery from the coronavirus pandemic. The plan also includes investment in green projects such as electric vehicles and hydrogen cars.
India and the European Union will hold a video conference summit on Wednesday. It will be co-chaired by Prime Minister Narendra Modi, European Council President Charles Michel, and European Commission President Ursula von der Leyen. aimed at strengthening strategic cooperation. The summit is taking place against a backdrop of China's mishandling of the COVID-19 situation and also the expression of its expansionist tendencies towards other Asian regions and also in the Indo-Pacific region.
The COVID-19 pandemic situation has seen frequent telephonic conversations between Prime Minister Narendra Modi and other European leaders on various subjects. The virtual summit on Wednesday will, however, focus on three significant areas, including cooperation in the post-COVID economy, including on subjects of global trade and investment, political and security issues, and cooperation on health.
Now, economics has been the core of this relationship. Now, EU is India's major trade and investment partners, but the FTA negotiations were suspended in 2013. So it means, at least from the summit, if we can restart FTA negotiations, that could be a good outcome. But the relationship has already become more strategic in the sense that discussions are taking place beyond trade and investment. The bilateral institutional mechanism now spans over 30 dialogue mechanism, which is counterterrorism, maritime security, foreign and security issues, urbanization, mobility. So there are many other issues.
The discussions will also focus on cooperation in multilateral fora, including the WTO, G20, United Nations, IMF, and the World Bank. Also significant would be talks on the cooperation between India and European development banks. Other areas of emphasis will be joint interventions in the global supply chain that is increasingly becoming China-centric, as well as the prospects of an alternative supply chain.
Well, it's quite clear that EU's suspicions about China are growing. It's looking for now further improving its ties with other Asian partners, particularly with India and Japan. Now, EU has established a new dialogue on China with the US. So I think it also would be useful if we also kind of improve our conversations on China with EU through certain structural mechanism.
India and the EU have robust economic and trade relations with the potential to grow. In 5G, digital economy, artificial intelligence and connectivity both can cooperate more intensely. India and EU trade is to the tune of $140 billion, of which $100 billion is in goods and $40 billion in services. In both these aspects, the trade balance is in favor of India. Increased cooperation will only enhance this advantage for both.
India and European Union are going to announce 5-year agenda of their cooperation. While political understanding between India and EU on all global issues are quite robust, there are issues in trade matters. While India wants low-hanging fruits to be harvested earlier, European Union wants a comprehensive trade pact between the two. So it will be interesting to see that how differences are wiped out so that India-EU relation can go into strengthening further. Akhilesh Suman for Rajya Sabha television in Delhi.
The Niti Aayog presented India's second voluntary national review on the implementation of the Sustainable Development Goals before the United Nations. The report laid a roadmap to help meet India's commitments towards Agenda 2030. It said that SDG sectors would need an additional annual spending of 6.2 percentage points of GDP until 2030. Kriti Mishra brings us this report.
Niti Aayog Vice Chairman Rajiv Kumar presented India's second voluntary national review at the United Nations High-Level Political Forum on Sustainable Development 2020 on Monday. He said all countries must come together to convert the present COVID-19 situation into an opportunity for accelerating the progress towards achieving the Sustainable Development Goals. He said the role of international cooperation is more critical than ever before. He also highlighted India's response towards the COVID-19 pandemic under the Atmanirbhar Bharat scheme.
India has made significant progress towards the SDGs and the Agenda 2030. We have been able to lift 270 million people from multidimensional poverty. The law on the right to education promises education for all. The Prime Minister's housing program promises a roof over every head by 2025 and piped water to every home. Electricity has already reached all our villages. 80 million households have access to clean fuel, 110 million toilets have been built, 385 million new bank accounts have been opened. We have launched the world's largest health insurance program covering 500 million citizens. The JAM Trinity has enabled us to shift all the beneficiaries in nearly 480 schemes to direct benefit transfers.
Rajiv Kumar also released the India VNR 2020 report titled Decade of Action Taking SDGs from Global to Local, which is a comprehensive account of the adoption and implementation of the 2030 Agenda in India. The report said that realization of the 2030 Agenda calls for state-of-the-art reporting and monitoring tools to measure progress under the framework and enable course correction. The report also notes that while the COVID-19 pandemic has put forth severe brakes on the momentum of global economic growth, India is fast exploring ways of developing relevant sectors of infrastructure and industry, such as the pharmaceutical and health equipment sector. India is also revisiting existing business models in a post-COVID-19 world by aggressive adoption of artificial intelligence and technology-based products and services in education, health and financial services, among others. The report states that integrated health labs in all districts, including block level and public health units, will need to be set up to deal with future pandemics, adding that there should also be an increase in public health infrastructure.
VNR presentation and our report from global to local is also in line with the Honorable Prime Minister's vision of an Atmanirbhar Bharat. It recognizes the challenges brought about by the pandemic and locates the importance of building back better. The report also highlights our approach to convert the present crisis into an opportunity for bringing about sustained improvement in people's lives and livelihoods through collectivized solutions and partnerships.
The report highlighted that migration has always been the result of mismatch between quantitative and qualitative aspects of labor supply and demand. The report has pointed out that the recently promulgated One Nation, One Ration Card scheme is critical for enabling access to subsidized food grains across the country, irrespective of the place of origin of migrants. Poverty elimination, good health and well-being, quality education, clean water, affordable and clean energy, reduction of inequality, creation of decent work and economic growth are among the 17 SDGs adopted under the UN framework. Voluntary national review serves as a basis for an international review of the progress of SDGs in a country. India presented its VNR along with other second-time presenters like Bangladesh, Georgia, Kenya, Morocco, Nepal, Niger, Nigeria and Uganda. Kriti Mishra's report for Rajya Sabha TV.
Union Transport Minister Nitin Gadkari on Tuesday inaugurated highway projects worth over 20,000 crore in Haryana.
The projects are part of new economic corridors in the state. They were unveiled through a web-based program presided over by Haryana Chief Minister Manohar Lal Khattar. They included 3 works worth 2,240 crore rupees. Foundation stones were laid for 8 projects worth over 17,000 crore rupees. The inaugurated projects include the 35.45 km 4-lane Hasangarh to Jhajjar section of NH 334B, the 70 km 4-laning of Punjab-Haryana border to Jeans section of NH 71 and the 85.36 km 2-lane Jeend-Karnal highway on NH 709. Foundation stones were laid for 4-lane access control Greenfield Expressway from Ismailpur to Narnaul, the 4-lane Gurugram Pataudi Rewari section of NH 352W and 14.4 km 4-lane Rewari bypass. Other projects included the 30.45 km 4-lane Rewari Ateli Mandi section of NH 11, the 40.8 km 6-lane Narnaul bypass on NH 148B, NH 11 and Narnaul to Ateli Mandi section of NH 11. the 40.6 kilometer 4-lane Jind-Gohana, the 38.23 kilometer 4-lane Gohana-Sonipat section of NH 352A and the 40.47 kilometer 4-lane UP-Haryana border to Roha on NH 334B. The projects provide connectivity to neighbouring states like Rajasthan, Delhi, Uttar Pradesh and Punjab while cutting down travel times significantly. Gadkari said the investment through the highway projects and corridors will revive the state's economy and boost industrialization during the times of the COVID pandemic. Union Minister of State General V.K. Singh said before 2014, Haryana had 2,000 kilometers of national highways and that has gone up to over 3,500 kilometers.
तो वाटर, पावर, ट्रांसपोर्ट एंड कम्युनिकेशन, ये चार बातें बहुत जरूरी होती है और चार बातें आएगी तो विकास होगा, औद्योगिक विकास होगा। इंडस्ट्री आएगी तो कैपिटल आएगा, कैपिटल और इंडस्ट्री आएगी तो रोजगार निर्माण होगा और रोजगार निर्माण होगा तो गरीबी दूर होगी।
Union Sports Minister Kiran Rijiju is interacting with sports ministers from all states and union territories in a two-day video conference to chart out a roadmap for grassroots level sports activities.
The conference will also finalize activities of the Nehru Yuva Kendra Sangathan and National Service Scheme. Calling day one of the conference purposeful, Rijiju said the state's proposed action plans to fight COVID-19 and further sports and youth-related activities. Rijiju said it is important to have a dialogue with the states to find the way forward for sports and youth-related activities. The states have been divided into two groups over 2 days to allow each of them to discuss their issues. Apart from restarting sporting activities at the state level, plans to conduct Khelo India events and youth festivals later this year or early next year will also be decided.
In Rajasthan, the Congress party on Tuesday sacked Sachin Pilot from the post of State Deputy Chief Minister and the party's state unit chief.
The party also removed two other ministers, Vishwendra Singh and Ramesh Meena, from the state cabinet. The decision was taken in a meeting of the Congress Legislature Party, its second in as many days. After the meet, Chief Minister Ashok Gehlot, along with two other senior leaders, met Rajasthan Governor Kalraj Mishra. Senior Congress leader Randeep Surjewala announced that Govind Singh Dotasra will be the new state president of Rajasthan Congress. Minutes after the party made the decision public in a press conference, Sachin Pilot tweeted, "Truth can be troubled, cannot be defeated."
आखिर में हमने पूरा मौका दिया, कल मीटिंग करी विधायक दल की, वो लोग नहीं आए। आज फिर मीटिंग उन्हीं के लिए रखी गई, एक प्रकार से एक मौका और देंगे, हो सकता वो ईश्वर उनको सद्बुद्धि दे आ जाएंगे, तभी वो नहीं आए।
Meanwhile, Rajasthan BJP President Satish Punia has said the party is not demanding a floor test in the state assembly as of now and is monitoring the situation.
पहली बात तो ये सरकार जाए, ये हमारी कोशिश रहेगी। दूसरी, आगे क्या होगा, वो जो राजस्थान की जनता के और लोगों के हक में जो चीज होगी उसको हम प्राथमिकता देंगे।
Union Minister Nitin Gadkari on Saturday paid tribute to former Rashtriya Swayamsevak Sangh chief Professor Rajendra Singh on his 17th death anniversary.
Born on 29th July 1922, Rajendra Singh was designated the 4th Sarsangh Chalak of the RSS on March 11, 1994. Popularly known as Rajju Bhaiya, he served as the chief of the organization between 1994 and 2000. Rajju Bhaiya's term with the RSS was one of the most crucial for both the Sangh and India. In 2000, owing to ill health, he decided to hand over his responsibility to K.S. Sudarshan. Rajju Bhaiya passed away in 2003. Before becoming a full-time pracharak of the RSS in the early 60s, Rajju Bhaiya was a professor of physics at Allahabad University. He was a firm believer of Swadeshi and empowering the rural economy.
And with this, it's a wrap on this edition of News Tonight. Thank you so much for joining us.
Thank you.